So hello friends, this is from Chambers and we have talked in the previous part about the distribution. Okay, so this is the part we discussed in the previous part. So let me show you some. Yeah. So now if you want your drug to be safe in your pregnancy, if you want to give a drug which should be safe in the pregnancy, safe in the pregnancy. So what should the properties, what properties will you look for to have the drug to be making you eligible, making the drug eligible to be given in the pregnancy, to be safe, because pregnancy we demand safety. So which drug, what should be the property of the drug to be given in pregnancy is it should be water soluble. It should be water soluble. Second thing, it should be more having a protein bound state. So plasma protein bound state will should be more, and it should be large. It should be large. Okay. So remember this point, that who will tell me that this drug is safe? It should be water soluble. It should be more plasma protein binding, and it should be protein bound and large. Okay. Okay. Why I said this large? What is the reason I said large? Because I know the small molecules, they can easily pass through the placenta. If I have a female who is having a thyroid disease, if I have a female who is having a thyroid disease, I usually, what is the drug I use? I use, if I talk about some thyroid drugs, I have polythiouracil, PTU, isn't it? Propyl thiouracil, isn't it? And if I compare two drugs, one is propyl thiouracil and another is methimazole. So what is special about this? I don't prefer giving PTU in the pregnancy. Okay, I don't prefer. Is this right? Is this the right statement that I don't prefer giving propyl thiouracil? Yes. Who can correct me? It's not. It's not that. Propyl thiouracil is actually preferred over this methimazole. Okay. So propyl thiouracil is more safer in pregnancy. So in pregnancy, I would prefer more propyl thiouracil because why? What is the property? It has a more plasma protein binding capacity. So I told you the property is, this is actually fitting the principles of safety in pregnancy. Okay. You know, if we have a bipolar disorder in psychiatry, bipolar disorder, we are giving for this drug, the drug is lithium. Okay. Why we are giving lithium? See, lithium, can you see this small name, lithium, isn't it? Let me give a positive charge also to it. Let me remove this and give another positive charge. So this is lithium. Lithium is small. So let us write for small. So that means its weight. What is the molecular weight? Lithium first starts with that. The one as stable. So lithium, low molecular weight. Will it cross the BBB? Will it cross the BBB? Yes, sir. It will cross the BBB. It will cross the BBB. Okay. Can I say what is the principle I told you? I taught you a trick that if a drug is BBB, then it should be plus placenta also. So can I say it is teratogenic? Can I say lithium is teratogenic? Can I say lithium is teratogenic? Because if a drug is able to cross the BBB, it can also cross the placenta. I taught you a principle, simple trick. I taught you a simple trick, conceptual trick, which I don't hope that you will be having in. I don't think that you have come across this, but I have learned it in my past from some basic principles that BBB, if something is able to cross BBB from physiology and neuroanatomy, neurophysiology, it will cross through the placenta. Okay. Are we able to understand? Okay. So let me tell you something about the VD. Let me tell you something about the VD. VD means volume of distribution. Volume of distribution. In the volume of distribution, it is the mathematical quantity which is equal to VD is equal to what dose I am administering. I am administering IV, and what is the plasma concentration. In what plasma concentration I'm giving the dose. So plasma concentration. So we write it in this way. VD is equal to dose divided by concentration 0. Okay. Concentration is always in mg per liter. Mg per liter. Okay. And remember, this C dot is basically why we are writing it 0. We are taking the plasma concentration at 0. We are taking the plasma concentration at 0 time. At 0 time, I'm taking the plasma concentration. Now, can I say VD will be high when plasma protein binding is low? Can I say VD will be less when plasma protein binding is more? Okay, are we able to understand? So why we are using this VD, sir? VD is actually used, it is helping me to calculate the loading dose. So VD is helpful to calculate the loading dose. So that means we have two terms. Please have a full concentration right now. Please look at me. So I have two things. Please remember, we have two things in our clinical practice. One is a loading dose. One is a maintenance dose. So what is the concept behind this loading dose? That means this loading dose is telling me before giving a drug, we always, for some drugs, now let us take this thing in this way. Let us take this thing in this way. If I said VD is more, what does it imply? It implies that more amount is going to the tissues. More amount is going to the tissues. That means if more amount is going to the tissues, plasma levels of the drug should decrease because it is having the high VD, isn't it? Isn't it? Can you write in the this box? Yeah. So plasma concentration is decreasing. That means I have to give higher doses of this drug so that I can get a very nice plasma concentration. So that means a drug which is having more volume of distribution is getting more into the tissues, and I am not having the drug in the circulation. So should I give a very big dose at first so that I close their mouths, so that this is the tissue, they have their mouths open. This is the blood circulation. So whatever drug I am giving, they are eating, they are eating, they are eating the drug. They are eating the drug, their mouths are open. That is the volume of distribution of this drug is more. The volume of distribution of drug is more. If volume of distribution of drug is more, I have to first close their mouth. I have to first close their mouth so that I can get a concentration, a nice plasma concentration. So what is the concept of this loading dose is we load these people, we close them. Okay. So what is loading dose? Loading dose means loading dose is a dose which is given for those drugs which have a higher volume of distribution, and to attain a very nice plasma concentration, or the dose which I want to have the plasma concentration, I will be first loading the tissues with the high amount of dose, and then I will be taking the maintenance. I will be giving a very small doses just to have a maintenance dose. Okay, this maintenance dose is also important. So the loading dose. So which drug? The question is, the important question sometimes asked is, which drug is having the highest VD? It is chloroquine. Chloroquine is an anti-malarial, isn't it? It's an anti-malarial drug, chloroquine, and we have to give a highest dose. That is The VD is around like 1300 liters per kg, I think. Okay, 1300 liters per kg. Okay, are we able to understand? Okay, friends. So I hope you have, you have understood this topic. Okay. Yeah. So let us continue. Let us write like this. Tell me one thing. If you have, if you have now given the now things have got distributed also. Now you will have. Let us talk about the metabolism also. So your metabolism, primary site of metabolism, your first site which is having the metabolism, it is. So let us talk about metabolism. So metabolism is liver. This is actually the king of metabolism, isn't it? He is actually metabolizing your everything, isn't it? What is the meaning of this metabolism, by the way? Metabolism means I am changing a drug from active to inactive form. I am changing a drug from active to inactive form. So what is the meaning of metabolism? I am changing the drug, making it either I can make it active to an inactive form, or I can make an inactive form to the active form, isn't it? I can take a drug from the active form to an inactive form, or I can, so I may be inactivating some drugs and I may be also making active compounds, isn't it? So if I have inactivated drug, if I have an inactivated drug and I am getting it metabolized by the liver, that means this inactive drug is a pro-drug, and it's only when the liver will metabolize them you will have an active metabolite. So we should remember some drugs which are pro-drugs, isn't it? We should remember some drugs which are pro-drugs, isn't it, my dear? So which drugs are pro-drugs? So let us write all people all people did MD, that is medicine, in California state. All people did MD in California state, because in the United States they call the medicine, the bachelor's, as an MD, isn't it? So we remember which drugs are, you know, in the which drugs are the pro drugs. Means I have to activate them. The liver has to activate them so that they can produce the active metabolites. Okay, so let us write A stands for ACE inhibitors. A stands for ACE inhibitors. So ACE inhibitors is all the pills. Okay, but two pills are not pro drugs. Which two pills? Please remember them. Which two pills are not which two pills are not pro drugs? That is captopril and lisinopril. Captopril and lisinopril are the two pills which are not pro drugs. Okay, so P stands for prednisolone. Okay, this P should be remembered as P cube. This P should be remembered as P cube. So one P is prednisone. Second P is proguanil. Proguanil. Third P is proton pump inhibitors. Okay, proton pump inhibitors. D stands for dipivefrin. D stands for dipivefrin. M stands for mercaptopurin. This was also cube. M is also cube. Mercaptopurin. Another M stands for minoxidil, which you are using every day for your hair, isn't it? potassium channel opener, and methyl dopa. Methyl dopa. M cube. Okay, M cube. So D stands for levodopa. Levodopa. I stands for irinotecan. Irinotecan. Okay. And C is also a cube. C is also a cube. California is also a cube. California is also a cube. C is carbimazole. Carbimazole. C is clopidogrel. Clopidogrel. We have read the clopidogrel in pharmacology, this physiology also, isn't it? In our physiology lectures. And C is cyclophosphamide. Cyclophosphamide. S stands for state. State stands for sulfasalazine. Sulfasalazine. So these all drugs are prodrugs. That means I have to activate them in the liver so that I can have the active metabolites. Okay. Further, we will be learning in the next videos. If you have not subscribed to my channel, please subscribe and see you in the next video. Thank you.